Nigeria's COVID-19 cases reach new threshold of more than 7,000. Kaduna State threatens to sack workers who participate in planned strike action. In international news, China's top legislature begins annual session. And in sport, senior Olympics official confirms Tokyo 2020 will happen next year.
This is ANN News.
I am Olajumoke Olatunji. Coronavirus cases in Nigeria has now crossed a new threshold after 339 new confirmations were made on Thursday. The Nigeria Center for Disease Control, NCDC, announced the toll has now risen to 7,016 COVID-19 cases in the country. Lagos posted the largest number of cases at 139, while Kano followed at a great distance with 28 cases. NCDC says 1,907 patients have been discharged, while 211 have died. The Nigeria Center for Disease Control is urging states to increase their efforts in collecting samples and testing for the coronavirus. NCDC Director General Dr. Chikwe Ihekwazu told journalists in Abuja on Thursday, success of states in controlling the COVID-19 outbreak could only be assessed when enough tests are carried out on people. He said testing is critical to the national response. Ihekwazu said the government's goal is to limit transmission. The NCDC boss says insufficient bed spaces has forced the government to discharge patients after just one negative test result. He also said to fully reopen the Nigerian economy would require every citizen to sacrifice by taking responsibility and observing recommended measures. The Kaduna State government says it is willing to sack any health worker that participates in the planned strike by the Congress of Health Workers Unions and Associations in the state. The state has opened a register to be signed by those who want to work despite the cut in pay. The governor on media and communication, Muyiwa Adekeye, said in a statement, government would not be misled into granting health workers a special status among public servants. The Congress of Health Workers Unions and Associations in Kaduna State had demanded the refund of a quarter of their salaries that were cut by the state government. There was also a demand for provision of personal protective equipment. In response to the union's threat of a strike, the government says anyone who fails to show up for work would be fired. The government says its health facilities would keep running and staff who want to work would be protected. The government says it would not yield to blackmail. The state government also said every Kaduna State government worker was affected by the monthly salary cuts that came into effect in April from the governor to the lowest rank. The government says the health workers are even being paid an allowance for occupational safety initiative as high-risk staff. That compensation is said to be 15,000 naira per day. Medium-risk employees receive 10,000 naira daily. The Nigerian military and the police in Lagos State are said to be undergoing a massive coronavirus testing because some officers and men had tested positive for the COVID-19 virus. This personnel is said to have contracted the virus while on medical duty. Some of them are receiving treatment at isolation centers in Lagos. The government says this is not unexpected since Lagos is the epicenter of the pandemic in the country. Lagos harbors nearly 3,000 of the country's more than 7,000 total cases. Flag Officer Commanding of Western Naval Command, Rear Admiral Oladele Daju, confirms that a naval lieutenant commander had recently died from the coronavirus disease. He said there were other 8 positive cases in the command with the more than 1,300 tests conducted. The Army's General Officer Commanding 81 Division, Major General Olu Irefi, says a female soldier had tested positive and is receiving treatment in the Armed Forces Isolation Center in Yaba, Lagos. Meanwhile, Lagos State Police Commissioner Hakeem Odumosu says 2 of his men were confirmed positive for COVID-19, but that they have been treated and discharged. The COVID-19 pandemic has created a vacuum in medical treatment of other ailments in Nigeria. Many who feel some form of symptoms that may not even be related to coronavirus are now refusing to go to hospitals, afraid they may be declared COVID-19 positive. Correspondent Kelechi Mekalam has the rest of the story.
Sylvester King is no stranger to hospital visits. He's been dealing with recurring bouts of malaria. But this time round, he has refused to visit a hospital to get proper care and has opted for self-medication instead.
In this period of the pandemic, going to a hospital is not really a good idea because of the coronavirus symptoms. Because malaria has the same symptoms as coronavirus. I don't want the doctors mixing up my high temperature for that of coronavirus, so I don't want to get exposed. So that's why I just stay at home and self-medicate.
But medics have warned people against doing that.
If you have typhoid fever, if you don't kill it, it will kill you. You get it? So if you have typhoid fever, for example, you stay at home because you are afraid of coronavirus, which is less evasive when compared to typhoid. Typhoid will give you high fever, will give you headache. Then your gastrointestinal system can perforate your intestine. We still need to play it back to the community so that we have to understand that coming to the hospital is not synonymous with contracting COVID-19, and not coming to the hospital is not a relief against COVID-19 if you have other conditions.
But fears of contracting the coronavirus aren't unfounded, so hospitals ensure all infection prevention protocols are in place as precautionary measures to avoid the spread of the virus.
First, we ensure that every patient who comes in the hospital is mandatory that you wear a face mask. So as you come in, there are basic questionnaire that we ensure that every patient fills in so that we can assess your risk for COVID-19. Thereafter, every medical personnel in the hospital uses a face mask too. And then in some cases, they also have a face shield. This is to protect the healthcare worker. With this, we minimize that. We also put some certain distances between the doctor or the healthcare worker and the patient. All these are to ensure that the healthcare worker is protected and to give confidence to the patient also.
There are several designated isolation and treatment centers for COVID-19 cases in Nigeria, but a number of patients have gone to undesignated hospitals for treatment. There are reports from private and government hospitals that patients with the virus lie about their status, putting health workers and facilities at risk. The result? A low turnout of non-COVID-19 patients who would most likely be in urgent need of medical attention. That too is making it difficult for hospitals to meet their financial obligations due to a significant drop in revenues.
Coming up, African news. African Center for Disease Control develops online platform for purchase of medical supplies. And later, international news. China's top legislature begins annual session.
You are watching ANN.
And add 888 join up. Yes.
Which time I go be this now? Not be the same 100 when everybody pays his money.
They no use code.
Which code?
Oh boy, no get it from market to get better. 888 now be the code yo. Have you?
Yes, so anytime you recharge with star 888 star pin hash, MTN will summer you with 5 times your recharge. Make you take turn up better a wolf.
Madam, I beg, start me
Welcome back. This is ANN News. In a quest to beat the fierce competition in acquiring necessary COVID-19 medical supplies, the African Center for Disease Control is spearheading a move that would allow the continent to better compete in the global market. It has developed a platform to pull orders to break into the global diagnostics and medical equipment market, from which it had been largely excluded. Correspondent Coleta Wanjoy has the story.
As cases of COVID-19 rise on the continent, the Africa Centers for Disease Control and Prevention is urging countries to respond fast.
The ability to track, test, trace, and treat individuals. I think that is the formula and strategy that we are pushing forward across the continent massively.
But these actions require enough medical supplies, the majority of which are imported. The Africa CDC says some countries are facing a challenge of procuring from manufacturers abroad because some of their orders are considered too small. Others are struggling because some nations that are producing the supplies have imposed restrictions on export. To avert this, the African Union is setting up an online platform for the purchase of medical equipment.
The platform is simple. It is like going to shop online. We ensure that the manufacturers who have been cleared have their products on the platform. And then countries will come in to see what they need, and they use that platform to be able to order what they need. That way, the manufacturers have been vetted and cleared, and the countries can comfortably be able to come and shop for what they require.
The piloting of the platform will be done this month, and some few countries selected according to region and size will be able to make real purchases and have them delivered.
The pricing will also have been negotiated. The product quality will also have been assured, so that when a country comes to buy, they are comfortable that the product they're getting at a good price. It is a product of good quality, and it is going to reach the destination where it is needed in the shortest possible time.
The Africa CDC says it is coordinating with the China CDC to connect countries with certified suppliers and to negotiate set prices. It hopes that with this consistency of supply, the continent will be better equipped to flatten the COVID-19 curve.
The Ugandan government has been delivering food to the homes of vulnerable persons affected by the country's COVID-19 lockdown, but people are being advised to ration the food they get. Why? Hilary Ayasiga has the answer.
The government has so far distributed food to 1.4 million residents.
We have served 1,427,411 people. And remember, our target was 1.5 million people. So in terms of food distribution in various parts of the Kampala and Wakiso and Mukono, our target is almost getting met. However, I know and I'm aware that as far as our budget is concerned, there's still more money within the budget which will feed additional bigger number of people. It is also true, what we found in the field is clear that there are more vulnerable people and there are more people who have been affected by the guidelines.
Each person is entitled to 3 kilograms of beans and 6 kilograms of maize flour. The government believes that this food will be enough to take them for at least a month. The beneficiaries say it's timely.
We will be cooking little by little to make sure that it will push us at least for some days.
It is still unclear when the country will lift the lockdown, which has been in place for 2 months. But government says they have a plan to help more families in need.
I'm happy we have a plan for the recovery on how to support the small-scale, medium traders for purposes of seeing how they can get back.
The government believes rationing food will help families get through the hard times of COVID-19. But there is no firm end date in sight yet.
Tunisia has been aggressive in its fight against the coronavirus pandemic, and it has seen some yield as a result. The country's retail business is said to be rebounding as coronavirus is believed to be winding down in that nation. Hadin Chawachi reports.
After 2 months of lockdown across Tunisia, the targeted health deconfinement has revived the economic activity in the North African country. As boutiques reopen, shoppers are also returning to their favorite shopping centers.
COVID-19 has caused the bankruptcy of many businesses, but the shops which have survived are lucky because we can pay our bills and make some profit. Some people still fear getting infected at the market, but I think it's safe now.
Shahla is a 50-year-old client and private sector employee. After spending 2 months at home, she has hesitated before shopping in downtown Tunis.
We are lucky because the spread of the virus is limited in Tunisia, but the morale of many is low as they face financial difficulties. Shopping is the only solution to boost this and help businesses.
The queues of shoppers snaked back along the Habib Bourguiba Avenue. Hundreds of people are patient as they line up even while maintaining social distance.
I'm happy because I can shop for my kids, but I'm very cautious. I respect the safety prevention measures. I'm keeping a safe distance and waiting patiently to be allowed inside.
The fasting period of Ramadan is coming to an end, and businesses across Tunisia have welcomed the shopping spree that has accompanied this annual holiday season. Tunisian Premier Elias El Farfer has declared that the greatest challenge will be to find the right balance between living with the virus and returning to normal life. He invited all citizens to continue to comply with the safety measures during the second phase of deconfinement, which will begin immediately after Eid al-Fitr.
When we return, international news. China's top legislature begins annual session. And later, sport. Senior Olympics official confirms Tokyo 2020 will happen next year.
You are watching ANN.
Welcome back. This is ANN News. Brazil has recorded its highest COVID-19 death toll of 1,188 in one day, bringing the total fatalities to more than 20,000. The country carries the brunt of the virus with 310,000 confirmed cases in the whole of Latin America. The nation comes behind United States and Russia in numbers of infections and deaths, making it the third most affected country in the world. Sao Paulo, Brazil's economic and cultural capital, is the most affected with about a quarter of the recorded deaths and infections. Almost all of the country's 27 states are under some sort of lockdown order. COVID-19 has killed more than 32,000 persons in Italy. It has also wreaked havoc on the healthcare system and economy. But as the country creeps out of lockdown, the toll on mental health is beginning to show. Psychologists have also reported a rise in the number of persons turning to them for help as they try to navigate the fear of the virus, emotional impact of physical distancing, and economic distress.
Isolation, depression, panic attacks, all examples of the psychological impact of living under lockdown. The 2-month period took its toll on the emotional state of many Italians, especially for older people such as this 85-year-old Maria.
I feel terrible because I feel to be in jail. I feel, I don't know when this virus go away, and I don't know what to say because of this nightmare.
Christina, who is an English teacher, was in the middle of a divorce when the pandemic hit. Together with her young daughter, she moved in with her parents, but says it has been challenging.
I tried to explain to her that there is this small virus that is, dictating what we should do with our lives right now, but I had to explain several times that when this is going to be over soon, that this is not going to be the new normal.
Christina says that though the easing of measures that began in May brings some relief, it also worries her.
I'm afraid that we will have to go back to phase one. And in a way, it's going to be even worse because you give people a glimpse of freedom and then you take it back. And I'm really scared that this is going to take a higher toll on people's minds than it is now.
A leading association of psychotherapists has designed an online platform called SOS Psychological First Aid to provide free online consultations. Dr. Flavia Posebella, a member of the group, stresses that the lockdown will have long-term effects.
It will be very difficult and complex to re-enter an emotional relationship, including social and intimate relationships, without perceiving this deep and internal fear that the other person may be a carrier of the virus.
Dr. Posebella recommends physical exercise, as well as self-expression through art and music for relaxation. She also urges people to avoid overexposure to negative news sources.
Staccarsi da questo iperstimolazione di informazioni perché aumenta la...
Break away from this hyperstimulation of the need for information because it increases fear and confusion. Obtain news only from the same accredited source of information twice a day, in the morning and in the evening.
Altro intervento molto importante è il dialogo.
Though online psychological support is not meant to replace psychotherapy, experts emphasize that during these stressful times, in a moment of crisis, services like this could save lives.
At Athens, the National People's Congress, China's top legislature, opened its third session Friday morning at the Great Hall of the People in Beijing. China's leader, Xi Jinping, and other Chinese leaders attended the opening meeting as Premier Li Keqiang laid out what has happened during the year and the road ahead.
现在，请默哀。
A minute's silence to mourn the martyrs and compatriots who died in China's fight against the novel coronavirus. Premier Li Keqiang praised the society-wide efforts to control sources of infection and contain the spread.
开展了疫情防控的
Together, we have waged an all-out people's war against the virus.
Premier Li said efforts must be redoubled to minimize the losses resulting from the virus, and he stressed the need for flexibility for targets.
需要说明的是，
I would like to point out that we have not set a specific target for economic growth this year. This is because our country will face some factors that are difficult to predict in its development due to the great uncertainty regarding the COVID-19 pandemic and the world economic and trade environment.
The Premier said stabilizing employment and ensuring living standards are key. Li Keqiang emphasized that on the way to eradicating absolute poverty and building a moderately prosperous society, no one will be left behind. He said that governments at all levels must truly tighten their belt, and China will not let up on any front of its long-term fight against COVID-19, nor will it lose any time in advancing China's economic and social development agenda. Li vowed to create a better business environment. He said the negative list for foreign investment will be significantly shortened, and China will grant great autonomy in reform and opening up to pilot free trade zones.
扩大开放。
We will foster an enabling market environment in which all companies, Chinese and foreign, are treated equals and engaged in fair competition.
Lawmakers will deliberate the bill on reviewing an NPC draft decision on the legal system and enforcement mechanisms for the Hong Kong Special Administrative Region to safeguard national security. The Premier also said the central government will adhere to major principles and policies on work related to Taiwan. He said it will resolutely oppose and deter any separatist activities seeking Taiwan independence. A draft civil code will be submitted for final deliberation. It will incorporate provisions on individual rights into a separate section of the code and help deepen the legal protection of personal dignity and individual rights.
Up next, sport. Senior Olympics official confirms Tokyo 2020 will happen next year. Please stay with us.
You are watching ANN.
We are on the road every day, canvassing throughout Africa for news you really need. We follow the story everywhere, from every corner of Nigeria to the wide African expanse. We bring you what's making headlines. We connect you with news you can use. ANN, African News Network, in a truly African spirit.
Welcome back. This is ANN News in Sport. Super Eagles coach Gernot Rohr has officially agreed to terms of a new 2-year contract by the Nigeria Football Federation. The Franco-German coach is set to sign the draft next week. Rohr's current contract expires next month. When Rohr signs this new deal, he would be mandated to live in Nigeria and also watch the Nigeria Professional Football League matches to scout for home-based talent. The International Olympic Committee says officials would start discussions in October to decide how the postponed Tokyo 2020 would play out. IOC has told Japanese Prime Minister Shinzo Abe, even with no vaccine in place, the Olympic Games cannot be postponed a second time. The International Olympic Committee's appointment for Tokyo 2020, John Quarters, indicates with 11,000 athletes, 5,000 technical officials and coaches, 20,000 media stations, 4,000 organizing committee members, and 60,000 volunteers. Plans have to start. That is ANN News this evening. Thank you for joining us. For details on these and other breaking stories, visit our website, ANNAfrica.news. Conversation continues on our social media platforms, Twitter, Instagram, and Facebook at ANN Africa TV. I am Olajumoke Olatunji. Have a safe weekend.